Hello, UN Friends of Vision. It's so good to have you with us today. Welcome to iHealth and SDG 8, Decent Work and Economic Growth. Our plan for what we're about to talk about is right there in our title. This conversation, this session is part of the high-level political forum. It's technically a side event, but when we're in the virtual world, there is no side in the virtual world. And when you consider that there are around about 1.1 billion people with impaired sight around the world, you know that this is a mainstream agenda, definitely not a side event. The theme for the high-level political forum is looking at COVID-19 and sustainable recovery. We will be connecting that with iHealth through the next hour and 15 minutes or so. So I'm really glad to have you here. We will be connecting SDG 8 with iHealth. We will be looking at the impact of COVID-19 and then of course the impact on unemployment of COVID-19, and again, all joining the dots with iHealth. So our session on iHealth and SDG 8 is brought to you by the International Agency for Prevention of Blindness, also known as the IAPB, and the UN Friends of Vision group. That group is chaired by 3 impressive chairs, and they will be bringing us our opening remarks so that we can officially get started. Thank you for your patience with the briefing. I know that also gave you a chance to get your virtual seating all sorted out. All right, let's go to Ambassador Monwa Hussain. It is good to have you, Ambassador Monwa Hussain. How would you like to kick off our proceedings, Ambassador?
Thank you very much for giving me the floor first. Let me speak on behalf of my peer, Ambassador Rava Fatima, who is unable to join at this moment due to technical glitches. So I would begin with, congratulating Honorable Sir Maulwin Joseph for joining us today, who is the Minister of Health, Wellness and Environment of Antigua Barbuda, and of course, the co-chairs, excellencies, friends, ladies and gentlemen. It is a great pleasure for me to welcome you to the Friends of Vision event at a very historic time for iHealth. Earlier this month, all UN member states agreed unanimously on the first UN resolution on vision. We are honored to have joined Antigua and Barbuda and Ireland in leading the Friends of Vision and are so proud to have led the first UN resolution on vision. We are extremely happy that our long journey, and particularly the dream of our Honorable Ambassador Webson, has found an accomplishment. In this regard, let me extend our felicitation to Ambassador Webson for receiving the award for Louis Braille Award for his achievement and service to the visually impaired people. And I hope this resolution, which will be adopted very soon at a session at the UNGA plenary, will be an important step to ensuring that everyone has access to the eye care services they need. I would also like to thank member states for their commitment and invaluable contributions throughout the process. I thank all the member states who have already co-sponsored the important resolution and would encourage all others here today to co-sponsor this. Dear friends, around 1.1 billion people across the world are living with preventable vision impairment. If they would have lived in one single country, this would have been the 3rd largest country on the planet. Such a huge amount of people are experiencing vision problems that can and should be treated. They are spread in poor and rich nations across all continents. For many, their vision can be saved with prevention and treatment and eye care. But without access to and availability of treatment, they face lifelong visual impairment, and for some, even unfortunately, blindness. Loss of vision results in loss of learning and loss of earning, which eventually deny them the opportunity they would aspire for. For those living with vision loss, the economic cost is monumental. Vision loss is calculated to cost the global economy US $411 billion in productivity every year. But eye care is transformative. An eye test for a child can be the difference between getting an education or not. A pair of prescription glasses can be the difference between having a decent work and not. Corrective eye treatment can therefore make the difference between improved vision and the total loss of vision. Ladies and gentlemen, as you will hear today from our experts, vision offers enormous potential to enhance employment prospects, increase workplace productivity, and improve overall economic productivity. Access to eye care services has been shown to increase per capita household expenditure by 88%, increase the household income, and improve the odds of obtaining paid employment by 10%. Preventable vision loss is a global challenge that needs a global solution. We cannot hope to achieve many SDGs, particularly SDGs 1, 2, 3, and 4, without making eye care central to our global efforts. We at the Friends of Vision will continue to advance eye health as part of the Sustainable Development Agenda and will work to ensure that the words of resolution turn into action. We are confident the work we all will do for protecting and promoting eye health is ultimately going to make the difference for all humanity. I thank you all for joining us today. Thank you very much.
Thank you, Your Excellency, Ambassador Monwa Hussain, stepping in like the leader he is. Thank you, really appreciate you very much. We move on with our opening remarks for His Excellency Ambassador Brian Flynn, Deputy Permanent Representative of Ireland to the United Nations and co-chair of the UN Friends of Vision Group. Ambassador, you have the floor.
Thank you very much, Femi. Delighted to be here and delighted to join our co-chairs, my good friend Monwar, and also looking forward to hearing from Ambassador Webson, who has really brought such leadership here to the group. And like Monwar, I would like to also extend my congratulations to Ambassador Webson on the awarding of the very prestigious Louis Braille medal recently. Also looking forward to hearing from Minister Joseph and the other speakers due to talk to us shortly. Ireland is proud to co-chair the Group of Friends of Vision here in New York, which has been highlighting for some time now the role of eye health in achieving the Sustainable Development Goals. We are very encouraged to see the broad support of UN member states in supporting our Vision for Everyone resolution, a really landmark resolution, which draws those important links between vision and the wider SDGs, and which will be adopted in the UN General Assembly shortly. The importance of addressing eye health globally in order to achieve SDG 8 cannot be underestimated. We know that at least 2.2 billion people worldwide are living with a vision impairment. Crucially, this figure includes an estimated 1 billion people who have a vision impairment that could have been prevented or is yet to be addressed. Those who are living in low and middle income countries are also far more likely to be disadvantaged as a result of their eye conditions. And this is especially true for women, older people, people with disabilities, ethnic minorities, and indigenous populations. If we are truly committed to addressing the root causes of poverty, inequality, and instability through the achievement of the Sustainable Development Goals, we must act to ensure that concrete steps are taken to scale up eye care and reorient it toward integrated people-centered eye care as part of universal health coverage. This will be crucial to the achievement of SDG 8 decent work. We know from the WHO World Report on Vision that strengthening eye care can yield positive economic benefits. Adults with vision impairment often have lower rates of workforce participation and productivity than the general population. Scaling up eye healthcare also creates jobs, both directly and indirectly, in the health workforce. Not only does vision impairment pose a significant global financial burden due to productivity loss, but addressing vision impairment can facilitate participation in the workforce, contributing to economic benefits and a sense of identity. There's a lot more we could say here now, but I think we're all anxious to hear from the list of speakers. So I'll pass back to you, Femi, and thank you again for giving me the floor.
Thank you, Ambassador. We have two keynote speakers, and they will help us really connect the topic that we're talking about today and why it is so incredibly important. Let's start with our very first keynote speaker, Honorable Sir Morwin Joseph. He is Minister of Health, Wellness and Environment for Antigua and Barbuda. Sir Joseph, it is so nice to see you. You have the floor.
Thank you, Excellencies, ladies and gentlemen. Thank you for inviting me to participate in this important event at this critical time. The COVID-19 pandemic still ravages much of the world. It is devastating lives and livelihoods. Sadly, it is also slowing and even reversing important progress on many public health, environmental, and sustainable development issues. As we battle COVID and prepare to build back from this pandemic, it is important that we use all the tools in our toolbox. Improve eye health and clear vision has obvious potential to help boost our recovery from the pandemic and rebuild momentum towards SDG achievement. According to the recent Lancet Global Health Commission on Global Eye Care, vision loss leads to global economic productivity loss of US $411 billion annually. The Commission's report also showed that simply providing glasses for near vision impairment can increase productivity by 22%. In our region, the Caribbean, vision loss is a growing challenge. While 6.2 million people live with vision loss in the region presently, that number is expected to grow to 8.9 million by 2025. Non-communicable diseases, lifestyle changes, and aging populations present a growing challenge globally. These are among the reasons why our government has helped to lead efforts to place healthy vision squarely in the SDG context. All the World Health Assembly in Geneva, we supported the resolution on integrated people-centered eye care, including preventable vision impairment and blindness. We were also pleased to see the recent adoption of the World Health Assembly targets for a new decade on eye health. In the Commonwealth, our High Commissioner, Ambassador Hill, has spearheaded our efforts to ensure that eye health is front and center on as many government agendas as possible. In Commonwealth countries, we have nearly halved the numbers of people at risk to trachoma. And of course, here at the United Nations headquarters in New York, under the leadership of our Ambassador Walton Webson, along with our friends from Bangladesh and Ireland, we are soon to adopt the first of its kind General Assembly resolution on vision for everyone. Our government has supported and sometimes led these efforts because they make sense. Improved vision unlocks human potential. It is a simple, cost-effective way to enable children to get an education, working-age adults to get and keep jobs, and improve equity for women and girls. Sadly, Many countries face daunting challenges fighting COVID, let alone attempting to make progress in advancing the SDGs. But we must advance them. We must leave no one behind. Eye health is an achievable means for advancing sustainable development. I wish to thank you and thank you all for this opportunity to address you this morning. And also thank you for what you have already done. And please continue to work with us to advance vision for everyone.
Thank you, Honourable Sir Morwin Joseph. Now, how do you follow a knight? Stuart Simonson. That is your role. Assistant Director General of the WHO. So great to have you. What are your keynote words that you would like to bring to us today?
Thank you. Excellencies, colleagues, and friends, thank you for including the World Health Organization in today's important discussion. While the global health agenda is preoccupied with the work of responding to the pandemic, we must rededicate ourselves to investing in health system strengthening, not only to build back stronger, but to be better prepared for the future. As we recover from the pandemic and strive to achieve the SDGs, we must always remember, that health is a precondition, an indicator, and an outcome of sustainable development. WHO is committed to the inclusion of eye care as an integral part of healthcare service delivery, so that all people can obtain the eye health services they need without financial hardship. But the field of eye care faces daunting challenges. The global demand is set to surge in the coming years due to population growth, aging, and lifestyle changes. And of course, the burden of eye conditions weighs most heavily on the poor, migrants, indigenous peoples, and persons with disabilities, and in rural communities. Beyond Sustainable Development Goal 3 and its target of universal health care coverage, there is a strong link between eye health and the achievement of the other SDGs. Specifically, improving eye health and preventing vision impairment directly contribute to the achievement of goals related to reducing poverty and improving work productivity, education, and equity. But this is only possible if eye health services are accessible to everyone, everywhere. Put simply, children depend on vision to walk to school, read, and learn, young adults to participate in the workforce, and the older population to maintain their independence. There are tremendous opportunities to strengthen intersectoral partnerships with education, the private sector, social services, and labor to improve eye health services. But these efforts must be aligned and coordinated with national government plans. We are encouraged to see the commitment of member states to this agenda with the adoption last year of the World Health Assembly resolution on integrated people-centered eye care and the recommendations on feasible global eye targets for 2030, including plans to systematically monitor progress, which was adopted at the World Health Assembly. WHO is pleased to see the developments with the United Nations General Assembly resolution on vision, encouraging greater coordination and vision with other global development priorities. WHO will, of course, continue to support member states in their work to improve the delivery of eye services, in particular through primary health care, to improve health information systems for eye care, and to strengthen the eye care workforce. 3 enabling factors for implementing integrated people-centered eye care. Thank you again for including WHO in today's discussion.
Thank you so much, Stuart. It's so good to have the WHO as a UN friend of vision. I want to give you an example of what can happen when somebody with impaired eyesight is helped to have improved eyesight. There's an enormous amount of change. Their productivity, what they can do in terms of work for their life, for their family. So I'm going to tell you about a little boy called Arif, who, when he was 5 years old, Sight Savers Bangladesh visited his village and transformed his life. We are catching up with Arif 15 years later. Hi, Arif.
Hi, cataract surgical team. I'm Arif.
I'm really glad that Sight Savers Bangladesh has come to my home again. I'm really happy. Can you recognize where I'm at this moment? This is my childhood home, where you visited me when I was a child. I have come to visit my parents. This is my mother, and this is Asma. She works for Site Savers.
Hi. It's been a long time since your operation has done. 15 years back, that means in 2005, and you were only 5 years old child. Do you remember the day when after operation your bandage removal?
আমার খুবই ভালো লাগছে
খুবই ভালো লাগছে।
Yes. আমার আব্বা আর আমার আম্মাকে
আম্মার
দেখতে
চেহারা
পেয়েছি।
আম্মার চেহারা দেখতে পাইলেন।
চেহারা দেখতে।
He just said that he feels very happy because it's the first time he clearly see and identified his parents.
Oh wow.
How do you think the operation has impacted in your life?
My life has changed because of the cataract operation. Now I live in the city in Dhaka. I have a job there. I can see clearly and I can work. If I didn't have the operation, I could never have a job.
So do you enjoy driving?
Yes, I really like driving. I hope to buy a small vehicle of my own in the future. If it is Allah's will, I'll buy a vehicle for myself. This is my dream.
The founding co-chair of the UN Friends of Vision Group is so special. He gets 2 introductions. Introduction number 2, His Excellency Ambassador Walter Webson, the permanent representative of Antigua and Barbuda to the United Nations. Welcome, Ambassador. It was worth the wait. The floor is yours.
Thank you very much, Phoebe, and I'll be quite short.
8:15 a.m. 3 notifications.
Honorable Minister Joseph, thank you so much for your presentation. We are honored and delighted that you are here with us. Representatives of WHO, excellencies, colleagues, friends. And I want to join my colleague ambassadors, Bernstein, Geraldine from Ireland, and Ambassador Fatima Rabana from Bangladesh for the hard work that they have and their team have done, worked with us in putting this together. Each year, the Friends of Vision has used the HLPF as an opportunity to demonstrate to the other member states in the UN and UN agencies all the work that we are doing. We demonstrate healthy visions and the potential to advance the SDG agenda. We are very proud this year that we are at a crucial point in getting through the United Nations system and putting before the system for the first time ever the resolution. I will speak more to that towards the end. It is exciting, however, to be part of this process, and I want to thank all our partners in the NGO sector for working with us. This momentous achievement stands out for the United Nations and for iHealth. For the first time, we will have this resolution focused solely on vision and explains for us the importance of vision within our achievement of the SDGs. Phoebe, I'm going to stop here and I'll come back to the end, but I want to say how exciting I am to be once again part of this process with this tremendous team of ambassadors, colleagues, and the tremendous support from civil society. So thank you, and everyone, you're welcome to this HLPF event. Thank you so much.
Thank you, Ambassador Webson. We look forward to seeing you at the end of today's program. I am looking in the chat section and I see that Irene Bougainville-Martin has asked an excellent question. I would like to ask, are attendees allowed to ask questions later? Irene, absolutely. You see that Q&A box? That is open there for you to put your questions in there. We are about to start the panel. And once we do that, if you're listening, you've got thoughts, you've got questions, put them in the Q&A box. I'm going to do my best to get as many of those questions answered as I can in the time that we have. And United Nations ambassadors who are with us today, please use the chat box, because if you would like to take the floor, we would like to share the floor with you. So I need your full name, your title, and the country you represent, and then we will spirit you away to our virtual green room backstage, get you prepared so that you can, again, be part of our discussion. So that is how you, dear audience, can be part of the conversation we are about to have. I want to bring in the panel because one of the things we want to do today is really hammer home this connection between iHealth, SDG 8, this economic growth and sustainability, connecting those two together. And I have three people who are happy to do that. Jennifer, Ella, Stefan, so good to see you. Jennifer, will you introduce yourself to our international audience?
Sure, great. Thank you so much, Femi, and such a pleasure to be here. So Jennifer Gutman, I'm the Vice President of Sustainability at Williams-Sonoma, Inc. For those of you who might know some of our brands, we're a Fortune 500 home furnishings retailer, a publicly traded company that has some of the best loved brands in home. So Williams-Sonoma, Pottery Barn Kids and Teen, West Elm, Mark and Graham, and Rejuvenation. And I sit within the sourcing and supply chain team, and I cover everything from climate and energy to our goals around worker well-being, which is really related to the conversation today.
So good to have you. Hello, Ella. Introduce yourself to our attendees.
Hello, lovely to see you all. I'm Ella Goodwin. I am the CEO of Vision Spring. I have spent the last 25 years in international development. I started off working on global health, and I have become an eyeglasses evangelist because I think glasses are one of the most underutilized, powerful tools that we have in our toolbox to advance so many of the SDGs. At Vision Spring, we have screened the vision of now millions and millions of people, but we are very excited about the impact of working in factories, in tea gardens, in workplaces, to be able to chip away strategically at this 1 billion people who need glasses, and happy to talk about more.
Oh, I'm looking forward to hearing that. Stefan, it's so good to have the ILO with us. Introduce yourself to our audience.
Yes. Thank you, Femi, and good afternoon to everybody, or good morning. I'm the Senior Disability Specialist in the International Labour Organization. For us, SDG 8 is a guiding light of the work of the ILO in general, but and in our case, we try to ensure that SDG 8 decent work becomes also a reality for persons with disabilities, including persons with visual impairment. For us, the other big international framework is, of course, the UN Convention on the Rights of Persons with Disabilities. Back to you, Fanny. Thank you.
Thank you, panel. I would love you to make this connection between eye health and economic growth. You all come to this conversation from different perspectives, and one of the assignments I'm going to give you is personalize the statistics. We know the numbers are huge. We're talking about 1.1 billion people with impaired vision who are not able to get access to eye health. Stefan, if you were going to personalize this, how would you do it? What story would you tell? What example would you give?
Look, it was very good to hear the story from Arif. The only thing I would slightly disagree with his statement was when he said, if I would not have had this operation, I would never had a job. It is partly true, but at the same time, I think we also need to remember that there are people who will not recover their vision. Yeah? And what we need to do and what we are working for is to ensure that persons with visual impairments, permanent visual impairments, can get a job. No? And I think the good news is that is starting to happen. We work a lot in the ILO with the private sector. We are seeing large global companies committed to disability inclusion, changing their recruitment processes, ensuring that digital accessibility, that their ways of internal systems and processes are open and accessible for people, for instance, use a screen reader. No? So that is for me the story that we should also convey. No? It is possible also for persons with a permanent visual impairment, persons who are blind, also able to get a job. And we're seeing that, we're even seeing that happening also within the UN family itself. No? So it's good to promote prevention of blindness, I know that, but at the same time, we should not assume that it's not possible that people cannot find a decent work. And I think it's important to combine both strategies. Thank you.
Oh, Stefan, that's such a powerful message. So powerful that Jennifer wrote down notes. Jennifer, what note did you write down?
That's great. Well, I think it's also about keeping people in the workforce. So, you know, that's been our journey to this was not direct. We didn't kind of set out looking at vision. We actually made a goal in 2015 to impact 100,000 workers in our supply chain, and we're really focused on financial literacy and literacy. We actually did a pilot in 2014-15 with a vendor of ours in Haiti, beautiful paper mache products coming out of Haiti. And what we found out from that vendor was that, you know, a portion of her workforce she was paying in cash. It was putting both her and the workers at risk because they didn't have bank accounts. She wanted to sign them up for bank accounts, and several weren't able to read. So we embarked on a co-funded literacy project with them. And as I was reading the report around the literacy projects, the interim report, I found that several of the artisans had actually not been able to complete the literacy program because of vision issues. And so it kind of speaks, I think, to that fundamental being able to not just, you know, secure employment, but keep it. And so that was really where we had that kind of origin story. We said, hey, you know, I come from the nonprofit sector. I'd known the work of Vision Spring, and I said, this must be a pretty pervasive issue in supply chains. And we said, you know, is there a there? So we found 3 factories. We did a pilot. We found over 50% of the workers needed some kind of corrective vision. The vast majority were first-time wearers. And today we've screened over 38,000 workers across 4 countries, hundreds of factories with Vision Spring. And those statistics have borne out. And we do have those impactful stories of someone who, for example, worked in quality assurance and was terrified day in, day out that he would lose his job because he was working with a prescription that was decades old and didn't know where to you know, have his eyesight, you know, and get a new prescription. So I think just that idea of kind of the terror of day in, day out in your job, being afraid of failure or losing, you know, this lifeline because of something that's so correctable is just so impactful.
Ella, unmute yourself. Go ahead.
Yeah, I'll pick up on what Jennifer was saying. I think the idea of the lost productivity is so real. And if you think about people being incredibly skilled and particularly in artisan trade or in the garment sector, and there's this really sad irony that vision impairment, you have vision impairment that can onset early in life, but many of us, the majority of us, are likely to need glasses, reading glasses, I'm wearing mine, when we start hitting middle age 40, 45. And at that time, we are peaking in the mastery of our craft. And so I want to take you, for example, to a sewing machine operator. Her name's Aliyah, and she's in Bangladesh. She had been a sewing machine operator for 12 years. She was at the top of her income segment in terms of the earning power that she had, but she wasn't able to thread her needle, and she started failing that quality checkpoint. So she got downgraded, and she had to start putting clothes on hangers, and she lost a lot of her income earning potential, and all she needed was a pair of glasses. And what I want to share is that happens hundreds of millions, it's happening millions and millions of times. These numbers are not small. And we are seeing that 25 to 40% of people in factories are needing the simple correction of vision of eyeglasses for maintaining their productivity and their income earning potential and their overall well-being.
So what I'm hearing from Jennifer and Ella is that the role that businesses have in supporting eye health. Stefan, pick up on that theme, take us further. What can and should businesses be doing for eye health of their workers?
Look, I'm not an expert on that, but let me share another situation. Imagine a person who has a visual impairment, perhaps that cannot be fixed. If the person is blind, let's say the situation is on the table. Everybody knows the person is blind. Okay, but imagine, and it's a real situation of a person with a rather severe visual impairment who has been hiding that situation towards their colleagues because she or he felt that disclosing that situation would not help with her career. And I'm talking about a person at a very high level of performance. No? So there's also this whole issue of disclosure, because in the absence of disclosure, when people cannot share their problem because they feel they might not even not get a solution. Sometimes it's a solution that Ella described. Sometimes it's a workplace adjustment to allow for that person to work with a screen reader. If people are not confident enough to disclose their situation, then we are, so that for me would be the first step for me, for companies, is to say, look, we would like to support you in that. Let's see what the problem is. Can the problem be fixed through glasses or some other assistive technologies, or what does it require workplace adjustment because the vision issue itself cannot be addressed. So I think allowing for creating the trust for employees to share their situation, for me, is an important first step. Thank you.
For me, this is such a positive conversation because it's about potential and it's not hard. Like there's some intractable challenges in this world and we're just like, how will we ever get to this? Whereas I feel with eye health, it's achievable.
Totally. Yeah, if I can jump in on that, I think one of the things that's so exciting about bringing vision correction to workplaces is it is scalable and it is cost effective. So we are able, depending on the country, so in Vietnam, it's around $11 a person. In Bangladesh, it ends up being around $5.50. In India, around the same, a little bit more. But we can screen the vision of an entire factory. So we can get to 300 people at a time, 2,000 people at a time, 15,000 people at a time, because some of these workplaces are really, really large. And we can do it in a cost-effective way. And that those prices that I was sharing with you, that is inclusive of the glasses, it's inclusive of the monitoring and evaluation, it's inclusive of the knowledge gathering and sharing. That is the fully loaded cost. That is really cheap. When you can imagine that we are going to increase productivity by 22 to 32%, where we're going to be able to help people get access into the workforce. And I think what Stefan was saying is people are getting rejected. People are being asked to thread a needle at their job interview. And if they can't do that, they might be a really skilled person and they're going to get rejected. They might be being removed from the quality checkpoint, for example, sorting coffee beans, and they're going to get removed from their point of employment. And there are so many things that are really expensive, and this one is not. And the other thing is the results are immediate. So I wanted to share a couple of, if I can, a couple of numbers around. It's not, so it's a triple win, right? So the workers have increased productivity and potential income. The employers benefit from that. And so do the upstream buyers. But the other thing is about overall well-being for the individual. So I want to share with you that what we have been talking to now over 240,000 workers, what we have found is that there are simple improvements in life, like removing pests and stones from rice and lentils. That went up by 93%. Using your mobile phone. The increase in mobile phone usage was 80%. If we are trying to do financial inclusion and get people into mobile banking and have savings accounts, they have to be able to read their mobile phones. Reductions in feelings of fatigue and headaches reduced by 96%. And we saw 97% of workers talking about an improvement in their self-confidence, just how they went about their day. These and improvements in reading holy books and holy text. So I think the thing to think about it is in the workplace, can vision screening be introduced as a common workplace benefit? If we are seeing that 70 to 80% of the people who need eyeglasses in a factory, in an artisan cluster, in a self-help group, do not have the glasses they need, that is so solvable. And we can transform access to eyeglasses and normalize eyeglasses wearing. I want to look back years from now and say, do you remember when when people didn't have glasses? Wasn't that ridiculous? And that's something that we can all do together.
I'm going to bring in some questions from our audience. Thank you for your questions. Keep using the Q&A box of your comments and your questions, and I will bring as many as I can to our panel. Okay, panel. What do you say about employers ensuring eye care safety, ensuring prevention from injury, for example? What is your thought about that? Workplace safety.
That is a great question, and I can jump in there. You know, and also just building off Ella's other comments. I mean, we have, you know, strict social compliance standards. We have our own compliance process, and monitor health and safety is something we take very seriously in the factories that we're working in. You know, protective eye equipment, and we've done some work with Vision Spring around that as well. But you know, the implications from a health and safety perspective on just being able to, you know, see especially when you're operating heavy machinery. I think, you know, we've talked about some cut and sew, but you know, our factory, we you know, we have products from couches to vases to lighting. And so, you know, if you're operating heavy equipment, it's imperative that you're able to see. And so the health and safety implications are also tremendous on this topic. And just building off of what Ella said, one, you know, thing we've seen from a lot of the workers who've been screened is also the ability to help their children at home with homework. So there's not just kind of the workplace benefits, but also kind of within the domestic space as well. And, you know, we've found that sometimes the hardest part is just kind of getting that start, because there's maybe either the shame or stigma over eyesight, or just it's a totally unmet and unrecognized need. So, you know, we've had vendors who in the past said, oh, you know, our artisans don't need that. And then we actually did a screening, and it was overwhelming need because people just had not ever had, you know, eye health on the top of their mind. The other piece about kind of the factory, and kind of building off of Ella's point around, you know, in the workplace, and it being so fundamental to the workplace, is you have, you know, a large group gathered, and, you know, it's really turnkey working with a skilled nonprofit to be able to kind of minimize the time that you're taking away from production. And that's something that, you know, my team always negotiates across our country offices and with our sourcing team. You know, a literacy program can take months, and these kind of training and worker well-being programs, and we're definitely invested in that. But, you know, for 15 minutes or a half an hour, you can make this intervention that's really life-changing and work-changing. So that's another impact that I think important to recognize here.
May I jump in there on what Jennifer was saying about kind of one of the barriers? I think we like to say it's the problem hiding in plain sight. So when we're often working with the administrators, you'll see a higher level of glasses coverage, the HR professional, the physician on staff, the production manager. Many of them have glasses. And then sometimes we'll introduce the idea of the high rate of uncorrected error in the workforce. And there will often be this moment saying, oh my goodness, I have been working in production planning for 15 years and it never occurred to me. And we'll say, come walk with us out on your floor now. And I want you to look at the workers and look at the ratio of people who are wearing glasses. Is the administrative staff genetically less strong than the workers? And the answer is no. And it's just this kind of, it's this issue that we don't see, but literally it's sitting right in front of us. And so the question is, what can we do? What can everybody who's listening to do today to say, this is the problem hiding in plain sight. It is literally right in front of us. And it is the absence of vision correction that we are looking for. And so what we want to be able to do is raise awareness in business coalitions. So things like, you know, it's been wonderful to partner with the Ministry of Handloom and Textile in India, or the Export Promotion Council, or BGMEA, the Bangladesh Manufacturing Association for ready-made garments, and to bring it to light with the ILO and others. If we think about all of those who are working in agriculture for tea and coffee production, and just say that we all have a role to play to address this issue in the workplaces. And it's not just strategic for the employer, and it's not just beneficial for the individual, but when we think about some of these sectors, they are so important to their economies. Bangladesh has 3 million garment workers, mostly women. They are responsible for 80% of the total export earnings of the country. And if we can imagine that 30% of that workforce can't see clearly, that is an unbelievable loss of opportunity and productivity. And it is so simple to solve.
Okay, I'm going to move on and I'm going to talk about COVID-19. Well, I'm not going to talk about COVID-19 and its impact. Stefan is, because our next question is about COVID-19. But Stefan, from the ILO's perspective, from what you do, your role, what have you seen so far in terms of the pandemic and people with disabilities?
Yeah, thank you, Femi. Look, it has been our main concern as disability team in the ILO to try to limit the negative impact of COVID-19 on the workforce. The first thing is, unfortunately, there's very little statistical information. There's a lot of anecdotal information available, but in terms of even countries that when they collected statistics on the impact on the labor market of COVID-19, unfortunately, usually they did not include questions that would disaggregate that information by disability, which is unfortunate. And it's a reminder that although we have done so much progress in terms of SDG, explicit references to disability, we have the UN Convention, it's still not an automatic reaction that when such a sort of emergency situation happens, that we think about persons with disabilities. I'm sure that all these collection of statistics have disaggregated by sex, have looked into the impact of men and women. They have not done so for persons with disability. I think that that's a lesson to be learned. No? We are talking now about this building back better. We need to learn from the lessons. We have seen that persons with disabilities have been overexposed to COVID-19. In particular, also in developed countries, people with disabilities living in institutions have been faced with death rates which have been much higher than those of the general population. But in the ILO context, we've also looked at the socioeconomic impact of the crisis. And we feel that although usually persons with disabilities working in larger companies and larger organizations have been relatively well covered and addressed by the pandemic, especially people with disabilities that are working in small and medium enterprises, people with disabilities that are self-employed, and people with disabilities are more likely to be self-employed than others because the labor market is still not open enough. They have been paying the price. Think about people with disabilities working in the formal economy in Peru, in Mozambique, in any other African countries. They have been paying a huge price in terms of impact of COVID-19. It's really there where our concern continues to be. And we need to remind governments that when they are now reactivating their economy, when they are promoting this building back better with a focus on digital economy and green economy, they need to ensure that persons with disabilities play a central role in that.
Thank you, Stefan. So that leads us into a question which I would never have thought about, but it's such a good one. Thank you. How do we deal with the snowball effect of people seeking eye care after more than a year of lockdown in some countries?
Yeah, that's a great one. So I think there's two elements. One is people have eyeglasses and eye care have often been locked up in the four walls of our health facilities. And one of the things that kept people away from seeking eye care during COVID was fear of going to hospital and fear of going to the clinics. So we will start to see that come down over time, which is great. But I think the other thing is, what can all of us do to bring eye care to where people earn and learn and play, and take eye care to where people are? One of the issues with eye care is people are not sick. And so there's often a lack of urgency. Unless people are having a really severe issue. And there's a lot of accommodation that people have for learning to adjust to blurry vision, and kind of there's like a feeling of, well, that's just me getting older, that's just the way life is. Or if I'm a child looking at a tree, I don't know that it's supposed to have leaves on it and it's not a blurry green blob. And so I think as we are looking at COVID coming down, we want to be able to introduce COVID-safe vision screenings in communities where we've got hand washing, social distancing, mask wearing, and we can bring vision screening into community, identify people whose vision correction can be solved then and there, and then create that referral bridge into the eye care sector and into the tertiary facilities where we can preserve the limited optometrist and ophthalmologist capacity for the higher level cases.
I'm going to tell
just to build off of that, you know.
Yes, Jennifer. I'm just going to let we have five more minutes of the panel. If you've been sitting on your question, put it in the Q&A section. The chat is down one side. The Q&A section has Q&A. Those are the questions I'm going to try and get to the panelists in the next 5 minutes. Jennifer, go ahead.
Great. Just to quickly build off of Ella's comments. we, made this ambitious goal, 100,000 workers impacted in our supply chain over 5 years through our worker well-being programs. And that was really the health literacy, financial literacy, but vision was a huge piece of that. And we met that goal this year, despite all the challenges of COVID. Thanks to Vision Spring's work in Vietnam, we screened 14,000 workers, provided 6,000 with glasses, and they did it through social distancing, hand washing, PPE, screens, but really, taking that cautious approach. And it was an amazing impact over the year.
I love this question because it's almost a call to action type of question. Thank you for asking us this, attendees. What is the role of the community in delivering eye care? Stefan.
Look, I'm not an expert on eye care. I think Jennifer and Ella would be much better placed on that. But I mean, in general, whenever we speak about persons with disabilities, the role of organizations of persons with disabilities to be involved in the design and implementation of whatever strategy is vital. And organizations of blind people and visually impaired have historically played a role, not only for those that are, let's say, permanently visually impaired, but have also been very active partners in blind prevention strategies. And Sight Savers, for instance, is a clear example of that. But I think Jennifer and Ella are better placed than me to answer that.
Yeah, I can jump in there. Thanks. But also,
go
ahead.
I'm thinking of the community as a global community and a business community and workers and employees. So we've got to think broader than, oh, this is your siloed area and this is your siloed area. So there is, and I know you know how to motivate workers and employers, because that's how change happens, rather than just look at it as eye health care. I'm thinking of that bigger global picture, which is the take that you bring. Jennifer, you go ahead.
Great. I know I'm nodding enthusiastically because, we started this program with Vision Spring as a pilot, and then we quickly realized, so we design our product in-house, but we manufacture with third parties. So the factories we work with are longtime partners, but we're not owners. And we're also not always the only client that they work with, or the other only brand producing there. So we really, looked to leverage some of those other brands. Where are we co-located, and can we come together to form a coalition? And Ella can speak to that more, but one of the kind of proudest moments, I think, for our company and kind of more broadly is our pilot with Vision Spring becoming, a really more expanded see-to-earn program with a coalition of brands that are committed to this work. I think, her points around how can we partner with industrial clusters? The more people that we can bring to screening events, the cost per person comes down, and can we have 100% served zones or geographies that include workplaces and schools, and how do we all partner together to have the widest reach?
Yeah, and I'll jump in there on the so one of the things that Jennifer's alluding to is what we did is, after some piloting, we created the Clear Vision Workplace Alliance. And this is it has industry groups in it, it has factory owners in it, it has brands in it. Some of the brands, including Williams-Sonoma, are Target, Levi Strauss, Williams-Sonoma. Oh, you're Williams-Sonoma. I'm so used to saying that. VF, which is behind Vans and other North Face and many other brands. And then what happened was USAID came in and actually matched. And so one of the things that's so important is that we do two things. We have to build the evidence base around productivity and income earning, and really importantly, workplace retention. Companies are spending so much money getting employers into the workplace. To lose them out the back end for vision correction seems like a really solvable problem. So we have 2 randomized control trials that are happening right now as part of that alliance. So there's a role for academics as well and research to build up the evidence base. The other is, it's a little bit like solar, that you need to have some people who are willing to lead and to subsidize and to create that demonstration site. And so the role of the brands has been to do that. And what USAID has done is they have, and this is what others can do, is think about how do you incentivize factories to just try and workplaces to just start. and to get their first vision screening done, because it kind of sells itself after that. The impact is so transformative, such that recently, and we were worried with COVID, that the retail sector had been hit so hard, the garment factories had been hit so hard that they wouldn't actually, employers wouldn't be willing to contribute their own resources. And that has actually, because of the demonstration sites, has now proven out. So we actually have factories approaching us saying, we want that program and we're willing to put some of our own money on the table. Right. And that's how we want to get this coalition effort going.
I just want to remind you, panel, we have such a simple title for our session: Eye Health and SDG, Decent Work and Economic Growth. I am giving you one sentence to wrap up the panel with. One thought, it's 30 seconds, no more. Stefan.
I think it's combining targeted and mainstream. No? I think one of the things that when you challenge me again now, Femi, is we can do a specific eye health program, but we also see in companies a lot of wellness initiatives. No? And sometimes other issues like mental health, it's easier to address certain issues, especially when there's some stigma associated with it within a broader framework, and then that you really reach out. I think I fully agree that we have the business sector has a unique potential to contribute to the identification.
Oh, absolutely.
And to addressing it.
Critical. Jennifer.
Just, what we found that, over 50% of factory workers needing some kind of corrective vision, and the vast majority first-time wearers, bears out across 38,000 people that we've screened. It impacts your livelihood, it impacts your mental well-being, and sense of job security. It impacts the factory, and being able to retain talented and skilled employees.
Thank you so much. And Ella.
I'll just say that as a group, we all have a role to play, and we can bring the wonder of clear vision to everybody, everywhere. And workplaces is the strategic place to start.
Thank you, panel. Excellent job. Thank you for the excellent questions, attendees, as well. We're a partnership. We work together. Really appreciate you.
Thank you so
Ella,
much.
Jennifer, Stefan, thank you very much for being part of our session today. We move on. This program, this event, is co-hosted by the International Agency for the Prevention of Blindness, the IAPB. The president of the IAPB is Caroline Casey. She joins us via video for some closing keynote remarks.
Your Excellencies, ladies and gentlemen, it is both hugely exciting and amazing honor to be here to close the Friends of Vision webinar today. It's really personal and incredibly exciting, and to be in a virtual room with so many different people from different backgrounds, different countries, different experiences, when our common things is our passion for our worlds to see equally, our passion for vision, for eye health care. It's an extraordinary moment that we are still battling with the concept and the idea that there are 1.1 billion people with preventable sight loss. I still can't quite get my head around that. How do we still turn a blind eye to this? I personally know the importance of vision. I mean, I think everybody knows it, but often people don't know about how important their eyes are until that vision is challenged. I have a very unique story about my own sight, which has led me to this place and to this moment. I was born with ocular albinism, but my parents brought me up as a sighted child, believe it or not, and I had no idea that I had such a significant vision impairment. I discovered at 17, and because the world didn't really at that point, well, it was my opinion, welcome people who had vision impairments or disabilities for that matter, I went into the disability closet, and where I stayed for 11 years. It was 21 years ago that I came out of that closet working for Accenture and told the world that I couldn't see so well. And since that time, I have been an advocate for disability inclusion and seeing that business is such an important part and powerful role to play in creating an equal world. And I want to end by saying you can hear the emotion in my voice. It's the first time I am speaking as the president of the IAPB. And what a moment to come in when you have done, all of you, so much work. I cannot wait to be part of this journey. I am a rebel-hearted activist. I'm a businesswoman. I'm a believer in the human spirit. I believe in change can happen. I believe that systems can change. I believe in the perfect timing. I stand in evidence to that as the founder of the Valuable 500. And I am so delighted to bring my near 50 years experience on this planet to this position. Thank you everyone for having such a productive, extraordinary webinar. I look forward to meeting and working with everybody, and just to everyone again, huge congratulations for this moment and for sticking to and for believing that change is possible. It is.
Talking about change and possibilities, World Health Day is on October the 14th this year. You may be thinking, why are you telling us about that right now? Well, I'm telling you about that right now because you have an assignment. Take a look.
Hello, my name is Joanna and I'm the Director of Communications and Development at IAPB. Almost all of us on the planet will experience an eye health issue in our lifetime. Yet, more than 1 billion of us don't have access to eye care services. This is a global issue, but one that starts with us. This World Sight Day, our theme is Love Your Eyes. To help us all focus on our own eye health, understand how important our eyes are to us and the value the job they do, we are thrilled to be announcing our most ambitious World Sight Day plans yet. This year, everyone counts. We're calling on everyone who can book a sight test, an exam or a screening to check on the well-being of their eyes. We want you to start thinking now how this September we can get over 1 million pairs of eyes tested by World Sight Day. It's no mean feat, and we can't do it alone. We will be mobilising our members, people across the eye health sector and members of the public to pledge a test so that everyone can help contribute to this goal. So whether you're an individual, an eye care professional or organisation, everyone counts. Then, on World Sight Day, we will host a global challenge to unite all of us, bringing people across the globe together to have their eyes tested. We hope to remind the world that everyone counts and how important it is to take care of our own eye health, and to highlight the work still to be done in achieving access to eye care services for everyone. Because Love Your Eyes loves children having the chance to reach their full potential, global economies boosted by increased productivity, older people who can participate fully in society, disadvantaged communities having greater access to vital eye care services. Eye care included in all health systems, workers supported by eye care initiatives in their workplace. So join us this year and love your eyes.
It's harder to do than it looks, right? Love your eyes. So, Ambassador Webson, I am going to welcome you back because you've listened to the conversation. This is an issue that you are passionate about, you are involved in, it is personal, it is something that you really want to make sure changes. Your thoughts as we wrap up our session today, Ambassador.
Thank you so much. I'll just, I want to end really by speaking a little bit about the resolution, but I'll make 2 comments to the presentations very quickly. First, I want to acknowledge the ILO's position with regards to the points raised in the video from Bangladesh with regards to persons with disability or persons who are blind. While it is a remarkable and obviously an outstanding thing that the young man was able to restore sight and regain his sight. Persons who are blind are not doomed to a life where they cannot be employed, etc. And we need to keep that in forefront and recognize. I am a living testimony of that. And there are many millions who are similarly doing work that allows them to keep their families, etc. You may hear running around me if I'm working from home, my grandchild, and that is my only grandchild, and she's 15 months or so, and that's a testimony of our livelihood. I also thought the rest of the presentations were extremely outstanding as we advocate in the use of glasses and the use that restoration of sight is critical in terms of us achieving the SDGs. We absolutely need it. The minister pointed out the loss that is gained from productive employment unless we did something about the production of glasses and the access to eye health care. I am a strong proponent of moving the conversation to eye health rather than just eye care. It is exciting to me to report to you all here today that our first of its kind resolution entitled Vision for Everyone, Accelerating Action to Achieve the Sustainable Development Goals, is on the verge of adoption by the General Assembly. This is a momentous achievement and very exciting. For the first time, we have a vision-focused resolution explicitly linked to progress in more than half of the SDGs. Our resolution encourages governments to take a whole of government approach, to see eye health linked to vision, advancing other development opportunities on the agenda. It invites the international financial institutions and donors to provide appropriate targeted finance for it. It calls on relevant UN institutions to support global efforts to achieve the vision for everyone and the achievement of the SDGs. But our work is not finished, my friends. As we wait for an adoption date by the United Nations General Assembly, we encourage member states, all member states, if possible, to join us in co-sponsoring this landmark resolution. Help us, my friends and excellencies and colleagues in New York, to demonstrate that vision cannot be adequately addressed in a silo. We must see vision within the broader health. Vision is a health issue, yes, but it's also an issue which can help drive the progress of the SDGs across all. I close by sharing our heartfelt appreciation to everyone. And I ask you to join the already nearly 40 member states who have co-signed so far. We want to thank you for your support and thank the partners from the civil society for joining us. I thank you very much, and I look forward to the next Friends of Vision event. Thank you.
Thank you so much, Ambassador Webson. This webinar was brought to you by the United Nations Friends of Vision Group and the International Agency for the Prevention of Blindness. Thank you for spending time with us. Love your eyes. Take care, everybody.